There's a state in America that has lost more than a third of its OBGYNs since enacting an abortion ban in 2022, where only 23 OBGYNs serve over 500,000 residents outside the 7 most populous counties, and where medical school applications dropped 6.7% the year after the ban took effect. The state is Idaho. And it's not even the worst on this list. Across America, while the political conversation argues about healthcare access, the real story is happening in 10 American states where doctors are quietly refusing to move, refusing to apply for residency, and refusing to renew their hospital privileges. According to the Association of American Medical Colleges, the United States is facing a physician shortage of up to 124,000 full-time doctors by 2025, and the geographic distribution of that shortage is brutally uneven. According to the AAMC's 2025 key findings, Idaho and Mississippi have the lowest density of patient care physicians in the country, while Massachusetts and the District of Columbia have more than twice as many. According to a 2024 study from the AAMC, OBGYN residency applications in states with near-total abortion bans dropped 10.5% year over year, more than double the national decline. And underneath those numbers, doctors are doing the math: salary versus malpractice insurance, career growth versus legal risk of criminal prosecution, family considerations versus state policy direction. And in 10 American states, the math has tipped toward no thanks. In this countdown, we're exposing the 10 states where doctors are refusing to move in 2026, not the cliché version where doctors don't want to work in rural areas. The real one. The version where state policy, malpractice insurance, scope of practice, abortion law, reimbursement rates, and physician population math have all converged to make these states actively repellent to the medical workforce. One state on this list has 159 doctors per 100,000 residents, the lowest in America. Another lost a third of its OBGYNs in 3 years. A third had 14 OBGYNs publicly state they were considering leaving in a senator's official survey. Think about it. You probably trusted doctor shortage was a national issue evenly distributed. It's not. It's geographically concentrated, accelerating, and getting worse in specific states for specific reasons that nobody's putting on a campaign poster. Subscribe before your state's hospital posts a no OBGYN available sign. Like the video if you've ever waited 6 weeks for a specialist appointment in a state that politicians keep insisting has world-class healthcare. Now you'll know why. Let's break it down. Number 10, Tennessee, where the country music is loud and the OBGYN residency applications are quiet. There's a state in the South where the abortion ban is among the most sweeping in the nation, where medical school applications to OBGYN residency programs have dropped, and where doctors who train there are increasingly leaving the state for their actual practice. Welcome to Tennessee. Tennessee has invested heavily in healthcare branding. HCA Healthcare, the largest for-profit hospital chain in America, is headquartered in Nashville. Vanderbilt University Medical Center is one of the most respected academic medical centers in the country. And underneath that brand, the post-Dobbs reality is that medical residents who trained in Tennessee are now choosing to do their residencies and their actual practices somewhere else. The numbers. Tennessee enacted one of the most sweeping abortion bans in the country following the Dobbs decision, with limited exceptions for the life of the mother. OBGYN residency applications to Tennessee programs dropped following the implementation of the ban, consistent with the national 6.7% decline in abortion-banned states. Tennessee has a physician-to-population ratio that ranks below the national average of 304 per 100,000. Tennessee was among the states identified in a 2024 AAMC analysis as seeing decreased medical student interest across multiple specialties, not just OBGYN. Multiple high-profile Tennessee-trained OBGYNs have publicly stated they relocated to other states because of the legal environment. Reddit quote, "Tennessee built a great medical training ecosystem, and now it's exporting the talent to states without the legal risk." What it's like. Practicing medicine in Tennessee is like dating someone whose family is genuinely lovely, but whose ground rules for the relationship change every time the legislature meets. Picture this. You're a fourth-year medical student at Vanderbilt in spring 2026. You're matching for OB/GYN residency. You love Tennessee. You love the program. You love the patients. And you love your future career enough to apply to programs in Massachusetts, Illinois, and California, because you don't want to spend 4 years of training learning workarounds for a state law that prohibits the standard care your textbook teaches. You match in Massachusetts. You're not the first. You won't be the last. Where it gets uncomfortable, Tennessee's structural problem is that the state has built world-class training infrastructure and is now watching the trainees leave at the moment they would otherwise be establishing roots. The hospitals are excellent. The training is rigorous. The cost of living is reasonable. The legal environment for OB/GYNs and emergency medicine physicians in particular has changed in ways that make the practice harder. Sharp contrast. Tennessee and North Carolina are neighboring southern states with strong medical academic anchors. North Carolina has Duke and UNC. Tennessee has Vanderbilt. Both have abortion restrictions. But North Carolina's is significantly less restrictive than Tennessee's. The residency match data has shifted accordingly. Tennessee isn't failing to attract doctors because the state isn't attractive. It's failing because state policy has made the practice of certain specialties more legally complex than in neighboring states, and the doctors are quietly choosing the neighbors. Number 9. Alabama. The Sun Belt state where the rural hospitals are closing, the OB/GYNs are leaving, and the female physicians make up only 29% of the workforce, among the lowest in the country. There's a state where 28 rural hospitals are at risk of closing, where 22 are at immediate risk, where the abortion ban is total, and where the percentage of female physicians ranks third lowest in the nation. Welcome to Alabama. Alabama is the Sun Belt's most quietly distressed healthcare state. The brand is SEC football, beach access, low taxes. The reality, for doctors, is a near-monopoly insurance market that distorts reimbursement, an aging physician workforce that's retiring faster than it can be replaced, and a legal environment that has made OB/GYN practice particularly fraught. The numbers. Alabama has 28 rural hospitals at risk of closing, with 22 at immediate risk in the next 2 to 3 years. Alabama enacted a near-total abortion ban after the Dobbs decision, with limited exceptions. Alabama's percentage of female physicians, 29.3%, ranks third lowest in the United States, well below the national average of 38.7%. Blue Cross Blue Shield of Alabama controls roughly 94% of the large group private insurance market, distorting reimbursement statewide. Alabama's ratio of active physicians per 100,000 sits around 217, below the national average of 304. Reddit quote, Alabama has a doctor shortage and a legal climate that makes it hard to recruit doctors to fix it. What it's like. Practicing medicine in Alabama is like dating someone whose family really loves football, doesn't really love science, and is genuinely surprised when the science professionals choose to live elsewhere. Picture this. You're a third-year medical resident considering staying in Alabama. You completed your training at UAB in Birmingham. You like the state. You like your colleagues. Then you look at the OB/GYN job postings. The malpractice premiums are high. The reimbursement rates from BCBS Alabama are below national averages. The legal environment has changed. The rural hospitals where you might want to practice are closing. You apply for jobs in Atlanta, Charlotte, Nashville, and Houston. You take the Atlanta offer. Where it gets uncomfortable, Alabama's structural problem is multifaceted. The state's healthcare market concentration distorts reimbursement. The Medicaid non-expansion has weakened rural hospital finances. The post-Dobbs legal environment has made OB/GYN practice more legally complex. And the recruitment math for hospitals trying to attract new physicians has gotten worse year over year. Sharp contrast. Alabama and Georgia are neighboring states. Georgia ranks 6th lowest for physicians per capita. A similar pressure, but with a more diverse insurance market. Alabama has the additional structural challenge of insurance market concentration that Georgia doesn't. Same deep south, slightly different recruitment math. Alabama isn't failing because the state isn't friendly to doctors. It's failing because the structural conditions of practicing medicine in Alabama, the insurance concentration, the legal environment, the rural hospital collapse have stacked unfavorably enough that early career doctors are quietly choosing the neighbors. Number 8. Arkansas. The Delta state where the rural hospital closure risk rate of 64% is the highest in the country, where the OB/GYN exodus has been documented in the Washington Post, and where doctors who stay are doing it on principle. There's a state where 30 rural hospitals are at risk of closing, where the OB/GYN coverage gap has been documented in major national reporting, and where the legal environment for reproductive healthcare practice is among the most restrictive in the nation. Welcome to Arkansas. Arkansas is the small southern state most non-Arkansans only think about during election seasons. And underneath the political branding, a healthcare workforce crisis that's been documented by the Washington Post, by Becker's Hospital Review, and by national OB/GYN surveys for years. The numbers. Arkansas has 30 rural hospitals at risk of closing, with 12 at immediate risk in the next 2 to 3 years, the highest percentage in America at 64%. Arkansas enacted near-total abortion restrictions following the Dobbs decision. Arkansas's ratio of physicians per 100,000 ranks among the lowest in the nation. The Washington Post documented in 2024 the case of Arkansas pregnant women driving over an hour for prenatal care because of the OB/GYN coverage gap. Arkansas's life expectancy ranks among the lowest in the country, with male life expectancy around 73 years. Reddit quote, Arkansas hospitals are recruiting doctors who genuinely don't have other options. Everyone else is going somewhere else. What it's like. Practicing medicine in Arkansas is like dating someone who's deeply religious, deeply hospitable, and deeply unable to afford the lifestyle they keep insisting they want. Picture this. You're a young OB/GYN considering job offers in 2026. You have an offer from a hospital in Little Rock for $310,000. You have an offer from a hospital in Kansas City for $295,000. A Little Rock offer pays slightly more. The Little Rock offer also requires you to work in a state with a near-total abortion ban, where the legal environment for emergency obstetric care has been the subject of multiple national news investigations, and where 64% of the rural hospitals are at risk of closure. You take the Kansas City offer. You don't even seriously consider the Little Rock one. Where it gets uncomfortable, Arkansas's structural problem is the combination of low absolute physician density, rural hospital fragility, restrictive practice environment, and a recruitment market where competing offers from less restrictive neighboring states are abundant. Sharp contrast. Arkansas and Missouri are neighboring states. Missouri's rural hospital risk rate is around 50%. Arkansas's is 64%. Missouri's abortion law, while restrictive, was modified by 2024 ballot initiative. Arkansas's has not been. Same Ozarks, very different practice environments. Arkansas isn't failing because Arkansas residents don't deserve doctors. It's failing because the structural conditions of practicing medicine in Arkansas have stacked unfavorably enough that the new doctors who would have moved there in 2015 are now quietly choosing Missouri, Kansas, or Tennessee instead. Hey, before we get into the rest of the list, the states we're about to cover are the ones where the physician-to-population math is genuinely catastrophic, where the recruitment crisis is documented in national medical journals, and where the residents who train there are leaving the day they finish training. If this list has been useful, hit subscribe, because the next one we're working on is 10 American towns where the last hospital just closed. And you'll want the names. Like the video if you've ever scheduled a specialist appointment 8 weeks out and watched it get rescheduled twice. Drop a comment if you're a physician who left one of these states or considered it. Real conversations happen in the comments, and I read them. Now, let's keep going. Number 7. Georgia. The Atlanta-anchored state where 14 OB/GYNs publicly told a U.S. Senator's office they were considering leaving, where 11 more know colleagues who have already left, and where Atlanta's medical brand can't outrun the state's regulatory environment. There's a state where U.S. Senator Jon Ossoff's office conducted a 2025 survey of Georgia OB/GYNs, where 14 publicly reported considering leaving the state because of the abortion ban, where 11 reported personally knowing a colleague who had already left, and where 5 said they were considering transitioning away from obstetric care entirely. Welcome to Georgia. Georgia is the state with one of the strongest medical recruitment brands in the South. Atlanta. Emory, Morehouse School of Medicine, the Centers for Disease Control headquartered in Atlanta. A Sunbelt state with significant population growth, and underneath the brand, a documented OB/GYN exodus that has been making national news since 2024. The numbers. Georgia enacted a 6-week abortion ban after the Dobbs decision. Senator John Ossoff's office conducted a 2025 survey of Georgia OB-GYNs in collaboration with the American College of Obstetricians and Gynecologists, ACOG. 14. Georgia OB-GYNs publicly reported they were considering leaving the state because of the abortion ban. 11 additional respondents reported personally knowing a colleague who had already left Georgia. 5 OB-GYNs reported they were considering transitioning away from obstetric care. Georgia ranks among the bottom 10 states for physicians per capita, around 179.9 per 100,000. Half of Georgia's counties had no practicing OB-GYN even before the ban took effect. Reddit quote, Georgia's brand says Atlanta and CDC. The actual practice environment says rural Georgia and a 6-week ban. The young doctors are choosing Atlanta or somewhere else. What it's like. Practicing medicine in Georgia is like dating someone whose Tinder profile is mostly Atlanta nightlife and whose actual life is mostly small-town conservative politics. Picture this. You're a Georgia OB-GYN reading the Ossoff survey results in 2025. You see 14 of your colleagues publicly considering leaving. You know 3 who've already left for North Carolina, Maryland, or Massachusetts. You're 38 with 2 kids in elementary school in Atlanta, a mortgage, and an established practice. You're not in a position to leave easily, but you're now in the position of being part of a shrinking pool with rising malpractice concerns, declining recruitment for new partners, and an increasingly clear sense that your hospital won't be able to replace the OB-GYN who retired last year. Where it gets uncomfortable, Georgia's structural problem is that the state had a real recruitment brand for medical professionals built around Atlanta, the CDC, and Emory. The 6-week abortion ban has changed the recruitment math in ways that have been quantified in a U.S. Senator's official survey. The ban applies statewide. The recruitment difficulty is statewide. The Atlanta brand can't fully insulate the state's medical workforce from the policy environment. Sharp contrast. Georgia and North Carolina are neighboring southern states with strong medical academic anchors. North Carolina has a less restrictive abortion law, 12-week limit. Georgia has a more restrictive law, 6-week limit. The OB-GYN recruitment patterns have diverged accordingly. Georgia isn't failing to recruit doctors because Atlanta isn't a desirable place to live. It's failing because the statewide regulatory environment has changed the math for OB-GYNs and emergency medicine physicians in ways the state's medical leadership has openly acknowledged. Number 6. Louisiana. The Cajun Coast state where the abortion ban is total, the population has been declining for 4 years, the rural hospitals are closing, and the OB-GYN density has been dropping for a decade. There's a state where 27 rural hospitals are at risk of closing, where 9 are at immediate risk, where the population has declined for 4 consecutive years, and where the legal environment for reproductive medicine practice is among the most restrictive in the nation. Welcome to Louisiana. Louisiana is the state where culture is genuinely unique. The food is genuinely incredible, the people are genuinely lovely, and the structural conditions of practicing medicine have been getting harder year over year. The numbers. Louisiana enacted a near-total abortion ban following the Dobbs decision. Louisiana has 27 rural hospitals at risk of closing, with 9 at immediate risk. Louisiana's population has declined for 4 consecutive years. Louisiana ranks among the bottom 5 states for life expectancy, with high maternal mortality. Louisiana's home insurance market disruption has indirectly affected commercial healthcare insurance markets. Louisiana telehealth utilization is roughly 7%, among the lowest in the nation. Reddit quote, Louisiana's medical recruitment slogan should just be honest. We have great food. What it's like. Practicing medicine in Louisiana is like dating someone who's beautiful, charming, and trapped in a 30-year cycle of disasters they didn't cause and somehow keep absorbing alone. Picture this. You're a young couple, both physicians considering a Louisiana practice. You finish training at Tulane. You love New Orleans, the food, the culture, the music, the weather. You start looking at job offers. The malpractice premiums are higher than in most states. The hurricane insurance for your future home is staggering. The legal environment for OB-GYN practice has changed. Your specialty's professional society has issued advisories about practicing in Louisiana. You take jobs in Texas instead. even though Texas has its own challenges because the math works slightly better. Where it gets uncomfortable, Louisiana's structural problem is multifaceted and compounding. The climate-driven insurance crisis affects everyone. The post-Dobbs legal environment has changed OB/GYN recruitment. The rural hospital crisis is acute. The state's broader fiscal pressure means hospital systems can't easily increase recruitment incentives. Sharp contrast. Louisiana and Texas are neighboring Gulf states. Texas has its own restrictive abortion law and rural hospital pressures. But Texas has a much larger metro economy in Houston, Dallas, and Austin with more diversified employment opportunities for physician spouses, more robust hospital systems, and more recruitment capital to compete. Louisiana has not. Louisiana isn't failing because Louisianans don't deserve doctors. It's failing because the structural conditions of practicing medicine in Louisiana have been sliding unfavorably for over a decade. The post-Dobbs environment has accelerated the decline, and the recruitment math has tipped against the state. Number 5. Texas. The Lone Star State, where the salaries are high, the malpractice caps are friendly, and the doctors are still leaving because the policy environment got more complex than the financial incentives could compensate for. There's a state where physician salaries rank among the highest in the country, where Texas's tort reform created some of the most physician-friendly malpractice caps in America, and where the bottom 10 ranking for physicians per capita persists despite all the financial incentives. Welcome to Texas. Texas is the state that should not be on this list, on paper. Top 5 in physician salaries. Strong tort reform. No state income tax. Major academic medical centers in Houston, Dallas, San Antonio, and Austin. Texas Medical Center, the largest medical complex in the world. And underneath all that, the state ranks in the bottom 10 for physicians per capita, with only 5 surgeons per 100,000 residents. The numbers. Texas ranks in the bottom 10 for physicians per 100,000 population, despite paying among the highest physician salaries in the nation. Texas has 5 direct patient care general surgeons per 100,000 population, tied with Oklahoma, Idaho, Utah, and Nevada for the lowest in the nation. Texas enacted a near-total abortion ban following the Dobbs decision, with limited exceptions. Texas has 47 rural hospitals considered vulnerable to closure, the highest absolute number in the nation. Texas's overall physician retention rate, despite competitive salaries, ranks below the national average for early career physicians. Reddit, quote, Texas pays great salaries. And then 4 years into your career, you realize the policy environment is going to outrank the salary every time. What it's like. Practicing medicine in Texas is like dating someone who has a fantastic income, a great car, a beautiful home, and a series of family rules that make every holiday genuinely complicated. Picture this. You move to Houston for a high-paying OB/GYN job in 2022. The salary is $410,000. The malpractice premium is reasonable. The cost of living is reasonable. You've been there for 3 years. You've watched the legal environment get more complex. You've seen colleagues face investigations for emergency abortion care that you would have considered standard practice 5 years earlier. You've talked to your spouse about Colorado, Minnesota, or Massachusetts. Your salary in those states would be lower. Your home would be smaller. The legal complexity would be lower. You're considering it. You're not the only one. Where it gets uncomfortable, Texas's structural problem is that the financial incentives the state has built over 30 years have stopped offsetting the policy complexity that has been added in the past 3 years. The salaries are real. The tort reform is real. The legal complexity for OB/GYN, emergency medicine, and certain other specialties is also real. And the math, for early career physicians choosing where to set up their lives, has tipped. Sharp contrast. Texas and Colorado are both western states with significant migration in. Colorado pays lower physician salaries on average, but has continued to attract physicians at a strong rate, with no abortion ban and a more diversified scope of practice environment. Texas has been losing physicians despite the salary advantage. Same region, very different recruitment outcomes. Texas isn't failing to attract doctors because the state isn't attractive. It's failing because the financial incentives that worked when malpractice was the main physician concern have stopped being decisive when the legal complexity has shifted. Number 4. Oklahoma. The state where the home insurance crisis is bleeding into the commercial healthcare market, where physician density ranks 48th out of 50, and where the recruitment crisis is documented in every Oklahoma Medical Society publication. There's a state with 208 active physicians per 100,000 residents, ranking 48th out of 50 in the nation, where the home insurance premium of $4,723 a year is the third highest in America, and where the structural conditions of practicing medicine have been getting harder year over year. Welcome to Oklahoma. Oklahoma is the state that doesn't get the national medical recruitment headlines that Texas does. Smaller economy, smaller medical school footprint, higher absolute insurance costs, and the same post-Dobbs legal environment that's made OB/GYN practice more complex. The numbers. Oklahoma ranks 48th in physicians per 100,000 population, with 208 active physicians, well below the national average of 304. Oklahoma has 5 direct patient care general surgeons per 100,000 population, among the lowest in the nation. Oklahoma enacted a near-total abortion ban following the Dobbs decision. Oklahoma's average home insurance premium of $4,623 is the third highest in the nation, with rates climbing 51% since 2019. Oklahoma's commercial property insurance has followed the home insurance trajectory, putting pressure on small medical practices. Reddit quote, Oklahoma is what happens when you combine high insurance costs with low physician density and a restrictive practice environment. The recruitment math doesn't work. What it's like. Practicing medicine in Oklahoma is like dating someone whose home insurance premium tripled in 4 years and who keeps insisting they're fine financially. Picture this. You're a young family medicine physician considering job offers. Oklahoma City is on the list. The salary offered is $245,000. You research the cost of living. You discover that home insurance for a $400,000 home in Oklahoma City is approximately $4,500 to $6,000 a year, depending on the zip code. You check Kansas, just over the state line. Same salary range, home insurance roughly half. You take the Kansas job. You're not the first. Where it gets uncomfortable, Oklahoma's structural problem is a stack. Low absolute physician density, high insurance costs across home and commercial, restrictive practice environment, aging physician workforce, and a state economy heavily tied to oil price volatility, which affects healthcare reimbursement indirectly through state Medicaid funding patterns. Sharp contrast. Oklahoma and Kansas are direct neighbors. Kansas's home insurance costs are roughly half of Oklahoma's. Kansas's physician density is similar, but its overall recruitment market is somewhat more competitive. Same planes, slightly different financial pressure on physicians. Oklahoma isn't failing to attract doctors because Oklahoma isn't a good place to live. It's failing because the cumulative financial pressure of practicing medicine in Oklahoma, combined with the post-Dobbs legal complexity, has tipped the recruitment math against the state. Number 3. Wyoming. The cowboy state with no medical school, with 1,245 active physicians for the entire state, and with one of the most acute recruitment crises in the country. There's a state with no medical school, where the entire state has roughly 1,245 active physicians, where most of those physicians were trained out of state, and where the recruitment math is fundamentally different from any other state in America. Welcome to Wyoming. Wyoming is the state with the smallest absolute physician workforce in America. Population around 580,000. Active physicians around 1,245. No medical school, no major academic medical center, and a recruitment problem that's been documented for decades. The numbers. Wyoming has approximately 1,245 active physicians for the entire state. Wyoming has no medical school, requiring all physicians to be trained out of state and recruited in. Wyoming's physicians per 100,000 ratio is around 211, well below the national average. Wyoming enacted a near-total abortion ban following the Dobbs decision, though portions have been blocked in court. Wyoming has lost roughly 20% of its preschool-aged population between 2010 and 2020, signaling demographic decline that affects family physician demand and recruitment. Wyoming has no Level 1 trauma center. Reddit quote, Wyoming has 1,245 doctors, and 5 of them know each other on a first-name basis. What it's like. Practicing medicine in Wyoming is like dating someone in a town of 800 people, where everyone knows your business and there's no movie theater. Picture this. You're a recent residency graduate considering a Wyoming opportunity. The hospital in Cheyenne offers you a competitive salary. The benefits package includes loan forgiveness. You drive through Cheyenne. The downtown is small. The grocery store options are limited. Your spouse is a physical therapist who would also need to find work. The nearest major airport requires a 90-minute drive to Denver. The nearest Level 1 trauma center is in Denver. You appreciate the offer. You take a job in Fort Collins, Colorado instead. Wyoming is 30 miles away. The recruiting hospital is in Wyoming. Your job is in Colorado. Where it gets uncomfortable, Wyoming's structural problem is the absence of a medical training pipeline, combined with a small absolute population, low absolute amenities, and a state government with limited capacity to subsidize recruitment at the scale needed. The state has tried loan forgiveness programs, recruitment incentives, tax advantages. The math doesn't quite tip. Sharp contrast. Wyoming and Montana are neighboring Mountain West states with similar demographic challenges. Montana has a small medical school presence and a slightly more developed academic medical infrastructure. Wyoming has neither. Same region, very different recruitment positioning. Wyoming isn't failing because Wyomingites don't deserve doctors. It's failing because the absence of in-state medical training, combined with the post-Dobbs environment, combined with the absolute small scale of the state, has made the recruitment math the most challenging in the country. Number 2. Mississippi. The state with 159 doctors per 100,000 residents, the lowest in America, where 36 rural hospitals are at risk of closing, and where the recruitment crisis has been the worst in the nation for decades. There's a state with the lowest physician-to-population ratio in America, with 159.4 active physicians per 100,000 residents, where 23 rural hospitals are at immediate risk of closing in the next 2 to 3 years, and where the post-Dobbs environment has compounded a recruitment crisis that already existed. Welcome to Mississippi. Mississippi is the state at the bottom of nearly every healthcare ranking. Lowest physician density, lowest median income, among the lowest life expectancies, highest concentration of rural hospital closure risk, and the state government has continued to refuse Medicaid expansion through 2026. The numbers. Mississippi has 159.4 active physicians per 100,000 residents, the lowest in the nation. Mississippi has 69 direct patient care, primary care physicians per 100,000, among the lowest in America. Mississippi has 36 rural hospitals at risk of closing, with 23 at immediate risk in the next 2 to 3 years, the highest absolute count in the nation. Mississippi enacted a total abortion ban following the Dobbs decision, with limited exceptions. Mississippi has not expanded Medicaid under the Affordable Care Act, despite repeated legislative debates. Reddit quote, Mississippi's physician shortage isn't getting better. The math has been bad for decades, and the recent changes have made it worse, not better. What it's like. Practicing medicine in Mississippi is like dating someone whose family has been in slow decline for 4 generations and who genuinely doesn't believe a different outcome is possible. Picture this. You're a Mississippi-trained internal medicine physician considering staying. You graduated from the University of Mississippi Medical Center. You completed residency at the same institution. You're 32, with 2 kids in elementary school in Jackson. You've been recruited by Memphis hospitals, by Birmingham hospitals, by Atlanta hospitals. The pay is similar in some cases, higher in others. The patient mix is comparable. The legal environment for the specialties you might consider expanding into is more permissive in Tennessee or Georgia. You start to seriously consider the Memphis offer. Where it gets uncomfortable, Mississippi's structural problem is that the recruitment crisis has been the worst in the nation for decades. The state has tried loan forgiveness programs, rural recruitment incentives, Medicaid expansion debates that haven't resulted in expansion. The math hasn't tipped. The post-Dobbs environment has made it slightly worse, not significantly better. Sharp contrast. Mississippi and Alabama are neighboring Deep South states. Both have low physician density. Mississippi's is the lowest. Both have abortion bans. Mississippi's is among the most restrictive. Same region, marginally different absolute floor. Mississippi isn't failing because Mississippians don't deserve doctors. It's failing because the structural conditions of practicing medicine in Mississippi have been the most unfavorable in the nation for decades, and the recent changes haven't reversed any of those conditions. Number 1. Idaho. The Mountain West state that became the cautionary tale of post-Dobbs physician flight, where over a third of OBGYNs left after the 2022 abortion ban, where 23 OBGYNs serve over 500,000 residents outside the 7 most populous counties, and where the recruitment of replacement physicians has been catastrophically slow. There's a state where the post-Dobbs reality has been documented more thoroughly than in any other state, where Idaho's abortion ban triggered a measurable physician exodus that has been the subject of academic research, federal litigation, and major national reporting, and where the math of practicing medicine in Idaho has tipped further against the state in 2025 and 2026. Welcome to Idaho. Idaho is the state that has become the case study for post-Dobbs physician recruitment. The state's near-total abortion ban took effect in 2022. The OBGYN exodus that followed has been quantified, documented, and litigated. The state has lost more than a third of its OBGYNs in 3 years. The replacement recruitment has not kept pace. The numbers. Idaho has lost over a third of its OBGYNs since enacting an abortion ban in 2022. Outside Idaho's 7 most populous counties, only 23 OBGYNs serve over 500,000 residents. Idaho has the lowest physician density in the country in some specialties, with 5.5 surgeons per 100,000 population. Idaho has the lowest percentage of international medical graduates in the country, at 6.2%, meaning the state cannot easily fill physician shortages with foreign-trained doctors. Idaho has no medical school of its own, requiring all physicians to be trained out of state. The U.S. Supreme Court litigated Idaho's emergency abortion law in 2024, leaving practicing physicians with prolonged legal uncertainty. Reddit quote. Idaho is the state where the abortion ban accidentally became a physician retention pool. Lycee by reverse selection. The doctors who didn't want to deal with it left. The doctors recruiting their replacements can't find any. What it's like. Practicing medicine in Idaho is like dating someone whose family rules changed overnight. The relationship still has potential, but the legal complexity is now a daily conversation. Picture this. You're an OB/GYN who has practiced in Boise for 12 years. Pre-2022, your practice was straightforward. Post-2022, your practice involves regular legal consultation, hospital risk management meetings about emergency abortion protocols, and conversations with colleagues who have already moved to Washington, Oregon, or Utah. Your malpractice insurance carrier has issued advisories. Your professional society has issued advisories. Your hospital's lawyers have issued advisories. You're 47. You're tired. You start considering Washington State. You move in 2026. You're not the first. You won't be the last. Where it gets uncomfortable, Idaho's structural problem is the most documented post-Dobbs physician exodus in the country. The data is clear. The legal environment is uncertain. The recruitment of replacement physicians has been catastrophically slow. The state's hospitals are increasingly relying on locum tenens, traveling physicians who fly in for short stints to maintain coverage. Sharp contrast. Idaho and Washington are neighboring northwestern states. Washington has no abortion ban, has a major medical training infrastructure, and has been actively recruiting physicians who left Idaho. Idaho has lost the recruitment competition badly. Same Pacific Northwest, very different practice outcomes. Idaho isn't failing to attract doctors because Idaho isn't a beautiful place. It's failing because the post-Dobbs legal environment, combined with the absence of an in-state medical school, combined with the small absolute physician workforce, has produced the most acute physician recruitment crisis in the United States. So there it is. 10 states where doctors are refusing to move, on the public record, in AAMC data, in Senate surveys, in residency match statistics, in academic medical journals, and in the daily decisions of early career physicians choosing where to set up their lives. States where the abortion ban changed the residency math. States where the malpractice and insurance environment compounded the policy environment. States where the rural hospital crisis hit the recruitment market at the worst possible moment. States where physicians who train there are leaving for less restrictive neighbors the day they finish residency. The American states attracting doctors in 2026, places like Massachusetts, Maryland, Minnesota, Colorado, and Washington, are not winning because they're trendy. They're winning because they have specific economic conditions, training infrastructure, regulatory environments, and quality of life conditions that make practicing medicine easier than in the 10 states on this list. The 10 states on this list represent the rest of America. The Deep South states with rural hospital crises and abortion bans. The Mountain West states with no medical schools and post-Dobbs litigation. The Plains states with high insurance costs. The Sunbelt states with insurance market concentration. The good news? You can know this. The AAMC publishes the State Physician Workforce Reports for free. The Becker's Hospital Review tracks rural hospital closure risk continuously. Senator-conducted physician surveys, like Senator Ossoff's 2025 Georgia OBGYN survey, are public. You can read this. Most people don't. Most people drive past hospitals on the highway and never think about who's actually staffing the emergency room. The reason doctors are refusing to move to these 10 states is because the recruitment math has tipped against the states for reasons that are quantifiable, documented, and not getting better. The salaries can be competitive. The cost of living can be reasonable. The legal environment, the insurance pressure, and the hospital infrastructure are not. And the physicians, the ones with options, are quietly choosing the states where the math works in their favor. If this list helped, share it with the friend who keeps insisting their state has great doctors. Hit subscribe because next we're breaking down 10 American towns where the last hospital just closed. And you'll want to see if your town is on the list. Drop a comment if you're a physician who left one of these states or considered it. And remember, the worst healthcare crisis isn't the loud one. It's the quiet one, where the OBGYN your daughter would have seen in 5 years has already moved to Massachusetts.